Ethics 46 Uninsured Patient EMTALA. A 52-year-old patient named Mr. Samuel arrives at the emergency department clutching his chest, visibly pale and short of breath. His symptoms are highly suspicious for an acute myocardial infarction. When the registration clerk asks for his insurance or payment method, Mr. Samuel admits he is uninsured and unemployed, stating, "I know I can't afford a hospital bill, but I feel like I'm dying." The clerk pauses the intake process and asks the physician, "Should we redirect him to the free community clinic down the street? If we admit him, the hospital will lose thousands of dollars." In this situation, the physician must act according to the Emergency Medical Treatment and Labor Act, EMTALA. This federal law ensures that access to emergency care is not influenced by a patient's financial or insurance status. EMTALA was established to prevent patient dumping or the irresponsible transfer of uninsured patients. Under this law, anyone who presents to the emergency department has the right to a medical screening examination to determine whether they have an emergency medical condition. It is illegal for a hospital to delay this screening or treatment to inquire about payment or insurance. In Mr. Samuel's case, even asking about his insurance before the screening is a potential violation. If the physician determines that the patient has an emergency medical condition, such as a heart attack, the hospital is legally obligated to provide treatment until the patient is stabilized, regardless of their ability to pay. A transfer to another facility is only permitted after the patient is stabilized, or if the hospital lacks the necessary resources to provide adequate care, and only if the benefits of the transfer outweigh the risks. Therefore, as the attending physician, you must immediately halt the financial registration process and proceed directly to clinical evaluation, as patient safety is the absolute priority. Financial and insurance matters should be addressed by social workers or the hospital's billing department only after the patient's condition has been stabilized. Violating EMTALA can result in heavy fines, loss of hospital accreditation, and legal consequences for the physician, making the immediate, unconditional treatment of this patient mandatory under both medical ethics and federal law.